welcome back to this segment on our channel called Answering Your Most Google Medical Questions by Haile Gastro, and today's video is a super interesting one. So let's get started. So in today's video, we'll be exploring the question, what are 10 complications that can occur during pregnancy and delivery? So every woman's journey to motherhood is beautiful and unique. Most pregnancies are filled with wonder, anticipation, excitement, and most of all, lots of love and joy. Whether a mother is experiencing the adventure for the first or the fifth time, it is bound to be a magical period of growth. But pregnancy can also come with plenty of stress and anxiety too. So most pregnancies progress without incident, but approximately 8% of all pregnancies involve complications that, if left untreated, may harm the mother or the baby. While some complications relate to health problems that existed before pregnancy, others occur unexpectedly and are unavoidable. So here are 10 complications that may occur during pregnancy or the delivery process. Number 1 is gestational hypertension. So gestational hypertension occurs when the arteries that carry the blood from the heart to the organs and the placenta become narrowed during pregnancy. High blood pressure during pregnancy may be associated with the higher risk of many other complications, such as preeclampsia, and puts the mom at a higher risk of having a baby well before their due date, meaning a preterm delivery. Gestational hypertension also increases the risk of having a baby who's much smaller than the average newborn size. Women who suffer from high blood pressure during pregnancy need to control their blood pressure with medications, but luckily the hypertension usually goes away soon after they give birth. Number 2 is gestational diabetes. So gestational diabetes is a condition in which the mom's blood sugar levels become high during her pregnancy. Gestational diabetes affects up to 10% of women who are pregnant worldwide each year, and these are all women who weren't previously diagnosed with diabetes prior to their pregnancy. A mom who suffers from gestational diabetes suffers the risk of having a baby who is larger than normal, as well as a baby whose skin looks yellowish and jaundiced at birth. Number 3 is preeclampsia and eclampsia. So preeclampsia is a pregnancy complication that's characterized by high blood pressure and signs of damage to the body's organ systems, most often the liver and the kidneys. Preeclampsia usually begins after 20 weeks of pregnancy in women whose blood pressure had previously been normal. And if left untreated, preeclampsia can lead to serious, even fatal complications for both the mom and the baby, including fetal growth restriction, which is when the placenta doesn't get enough blood, causing the baby to receive inadequate blood and oxygen and fewer nutrients, which in turn leads to slow growth, low birth weight, or preterm birth. Another complication is placental abruption, which is a condition in which the placenta separates from the inner wall of the mom's uterus before delivery. And the last complication is the development of eclampsia, which is essentially preeclampsia plus life-threatening seizures on top of that. Number 4 is preterm labor. So preterm labor occurs when regular contractions result in the opening of the mom's cervix after week 20 and before week 37 of her pregnancy. Preterm labor usually results in premature birth when the baby's vital organs, such as the lungs and the brain, haven't finished fully developing, which means the newborn will require intensive care treatment until they are able to survive on their own. The risk factors for a preterm labor include smoking, being overweight, and having diabetes or hypertension. Number 5 is a miscarriage. So miscarriage is the loss of pregnancy during the first 20 weeks of gestation. Up to 20% of pregnancies among healthy moms will end in a miscarriage. Sometimes this happens before a woman is even aware of the fact that she is pregnant. The causes of a miscarriage include infections, exposure to harmful chemicals or radiation, drug use, alcohol abuse, excessive caffeine consumption, smoking, medical conditions in the mother such as diabetes or thyroid disease, as well as bodily trauma to the mom. Number 6 is anemia. So the mom's body goes through significant changes during her pregnancy. The amount of blood in her body increases by about 20 to 30%, which increases the supply of iron and vitamins that the body needs to make hemoglobin, which is a protein in the red blood cells that carries oxygen to other cells in our body. Mild anemia is normal during pregnancy due to an increase in the body's blood volume, but more severe anemia can put the baby at a higher risk for anemia later in infancy. Most moms are prescribed supplements of iron and folic acid during their pregnancy to prevent any severe cases of anemia. Number 7 is infections. So during pregnancy, some common infections that may occur are influenza, vaginal yeast infections, eczema, herpes, uterine infections, group B streptococcus infections, bacterial vaginosis, and listeria infections. So changes in the immune function, such as a reduction in T and B cell activity and natural killer cell activity, and increases in dendritic cell activity may cause this increased risk of infection in the mom. The severity of some infections, such as influenza, sexually transmitted diseases, urinary tract infections, and the Zika virus, may also increase with advancing pregnancy. Complications from severe infections during pregnancy may include a preterm birth, a low birth weight for the baby, birth defects, learning difficulties, and possibly even a pregnancy loss. Number 8 is a breech position. So a breech position is when the baby's buttocks, feet, or both are poised to come out of the vaginal canal first during the birthing process. This is instead of the coverted vertex presentation, which means positioned vertically in utero with her bottom up so it may exit the vaginal canal head first. A major complication of the breech presentation is cord prolapse, which means where the umbilical cord drops down below the presenting part of the baby and becomes compressed, and other complications include fetal head entrapment, premature rupture of the membranes, birth asphyxia, and an intracranial hemorrhage in the child. Number 9 is placenta previa. So placenta previa occurs when a baby's placenta partially or totally covers the mother's cervix, which is the outlet for the uterus. Placenta previa can cause severe bleeding during pregnancy and even delivery. It may also cause shock from the loss of blood, fetal distress from the lack of oxygen, premature labor or delivery, blood loss for the baby, and in some severe cases, sometimes even death of the child. And finally, number 10, which is a low birth weight. So a low birth weight usually occurs due to poor nutrition or the use of cigarettes, alcohol, or drugs during the course of pregnancy. Babies who are born at a low birth weight have a higher risk of respiratory infections, learning disabilities, heart infections, and blindness. And that brings us to the end of this video. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you would like to help us make better videos and content, you can also donate to us via PayPal. Take care, and thanks for joining me today as I explored the 10 complications that can occur during pregnancy and delivery.